Whether you're having a not moving off the couch while you watch the game kind of day, or a no time between conference calls kind of day, it can still be a delicious Dunkin' kind of day. And with Dunkin' now available on DoorDash, it's easier than ever to get your faves brought right to your door. So if you're looking for coffees, donuts, and breakfast sandwiches in the morning, craving some afternoon snack and bacon, or in need of Dunkin' refreshers for a PM pick-me-up, we've got you covered. Order now and get your faves brought to your door through Grubhub, Uber Eats, and DoorDash. Price and participation may vary. Exclusions apply. America runs on Dunkin'.
Hike the trail? Check. Order takeout? Check. Schedule heart checkup? Done. We've all adapted to a new way of living. Keep your healthcare on schedule with Johns Hopkins Medicine, where your health and safety are our highest priorities. We're ready to care for you through virtual and in-person visits across Maryland and the greater Washington region. Your health, our experts, safely caring for you. Schedule your care now. Learn more at hopkinsmedicine.org/safe.
This episode of the podcast is sponsored by Grammarly Premium. Get a 1-month free trial of Grammarly Premium. Click on the links in the description. I use Grammarly Premium and it's fantastic. Also, thank you to vidIQ for sponsoring today's show. Click on the links in the description if you want to get those views and watch time and monetization on YouTube. Click on the link to find out more. Thank you to Amazon Music Unlimited for sponsoring today's show. You can go and get your free trial on my website. Click on the link to my website to find out more. Welcome to the Stephen Shiels radio show. Today I've got Peter Sidgreaves, the Liberal member for Camden. How are you, Peter?
Very good, Stephen. It's a pleasure to be on your show.
Thanks for coming on today, Peter. What have you been working on for 2021?
I've been working on lots of things, to be honest. So, you always kept busy in the electorate office and you always kept busy in Parliament. Mm-hmm. So it's just about getting out as much as I can and, speaking to the community, speaking to what their concerns are, what they think is, can be done, and then trying to liaise with ministers and using Parliament as an opportunity to achieve those types of goals that you set for yourself and what the community wants.
Now, being the Liberal member for Camden, are you on the lower level of Parliament? Are you? How does it work?
If you say, I'm certainly a backbencher, so I'm not a minister or a parliamentary secretary, but that doesn't prevent you from having access to the ministers and even the Premier when need be, mm-hmm. To ensure that you're delivering for your community.
Mm-hmm. What's the most challenging part about your role as a Liberal MP?
Well, certainly it's not challenging anymore, but I think the biggest challenge you go through is when you're first elected. My 6.5 years that I've at the time I was elected, that I've been on Camden Council, really doesn't give you a lot of preparation for what it's like to be a member of Parliament in the State Parliament of New South Wales. So that's always a challenge for many members. Thankfully, I've kept on my predecessor's staff, which made the running of the office very smooth. And I, being the mayor of Camden previously, I already knew a number of ministers who were very helpful in terms of getting your head around the way Parliament operates and what every tiny part of Parliament means, and where you can contribute into that Parliament. Speaking on different matters. So it's been a learning curve, but lucky for me, probably not as much as many other members who may not have had that that experience on Camden Council, even though it's very different to what Parliament is, but also having the opportunity to know ministers when you go in. So.
Do you hopefully want to become Prime Minister one day, or is that very hard?
Look, I can say that I don't have any aspirations to be Prime Minister, or nor Premier for that matter. But my current role, and I enjoy it thoroughly, is to be able to represent the people of the Camden community. So, look, I'm a father. I've got a wife and 4 young daughters to look after. So they are my priority. But then equally, it's about representing the community. So certainly at this time, I'm not looking on taking on any more responsibilities into Parliament, whether it be a Parliament secretary or a minister. But you can be reassured that as a backbencher, as a member of Parliament, and a member of the government, I do have access to those ministers and the Premier where needed to ensure that any of the commitments that the Liberal government have made for the electorate of Camden, that I'm there always fighting for those.
No, I think what you're doing a good job. I'm a supporter of the Liberal government because I feel they do things better. But I think in Australia, at least, we do have a government that cares for us too.
Yeah, certainly. There's no question about that. And if you're looking for, particularly in the state, you won't get a more compassionate leader than Gladys Berejiklian. So, and when I went into Parliament in my inaugural speech, there were a number of values that I listed about myself, and compassion was one of them. And you have to have compassion because you've got to look after all types within the community. But in terms of Liberal government, we do have that strong financial management, and that's the background that we come from, because without that, you can't always afford to look after those most vulnerable in the community, and we certainly are striving to achieve that.
Yeah, I do feel the Liberals are more business-orientated, which is what I like too. I do like what the Labor government's done with Medicare years and years ago as well. So I think...
look, there's no question about that, and I would acknowledge that as well, Stephen. If you just look around the world and look at how people are dealing with COVID when you're in Australia and whatnot, and if you are unlucky enough to have to deal with COVID, then you've got that Medicare system there to back you up when you go into hospital. So we are very fortunate. There's no question about that, and it was absolutely a landmark decision by the government of today.
And what's you've done? Have you run a business before, or what did you do before you became a Liberal MP?
So I originally, after I left school and while I was studying business at university, I worked for 5 years at my father's company, which was his father and his uncle's business before that. So it's actually it's now about 104 years old. So very strong small business background. Working there for a number of years, for 5 years, as I say, before I went into what I call my passion. It's still my passion today, and that's the information technology industry. So I worked in there for 20 years. The last 15 of those years were working at Sydney Catholic schools and really supporting technology, but more importantly, the integration of technology into teaching and learning, or pedagogy, as they say, and that's what I enjoy most about technology, not just the raw technology, but actually putting it to good use. And in that case, that was in the education area. So I thoroughly enjoyed that. Yep.
Yeah, there's so much hacking going on in the IT world now. I think people trying to hack all these things and all these securities changing. We're becoming a subscription society too, I've noticed as well.
Yeah, so certainly when it comes to cybersecurity and whatnot, that is only getting bigger and will always continue to get bigger. But, and that's why it's imperative of not just the government, but leaders in business who are dealing with cybersecurity and, all these threats and vulnerabilities, that they take the leadership on this as well. And I would add that they are. This will probably always exist when it comes to technology, but it's important that we're most importantly protecting personal information that people give those organisations when they register for their service. And as you said, subscription model, that's certainly true. That's been on the horizon for a while now, and I'd say over the last 2 to 3 years that's certainly come to fruition. But with technology rapidly changing, who knows where we'll be moving next in the next 5 to 7 years. But there's a lot of speculation about things such as blockchain and cryptocurrency and whatnot. So we'll just have to wait and see. And those leaders in the industry, they will guide us and be supported by the governments of the day. Yep.
Yeah, because I remember Microsoft Office used to be able to purchase it for a one-time fee, but now they want you to pay a yearly subscription because of security. I mean, there's good and bad to that too.
Well, no, there is. But rather than paying X amount for Microsoft Office once, and I would say getting limited updates. When you purchase these services, not only do you get the full suite of, for example, Microsoft Office, as you raised, and you do pay an annual amount on that, but you're certainly getting a larger suite of tools when it comes to that subscription model. You can access that on any device. Likewise, you can access it through your browser. So this is the way that these organisations are heading, and it's because, if you think about, let's say, 10, 20 years ago, you were lucky if you had one device. These days, we're talking about kids who have been born into a generation where they've always had technology, and even adults these days, will have probably 2 or 3 devices at the very least. So this is why these subscription models are becoming very popular, because you can move them from device to device to device.
I'm a bit old school, Peter. I like to purchase DVD.
So do I. Certainly there's a huge onslaught from streaming services such as Netflix, and now we have Disney and Apple TV, and we're really spoilt for choice with regards to that, and that also becomes an easy model in the same way that the subscription model has. Look, I have to admit, I like buying some of those DVDs as well. So if there's a season on, or a show on Netflix, for example, that I really like, I tend to want to go out and buy the DVDs as well. So.
And, with COVID-19, we got a vaccine coming around the corner. I talk about this a lot. Are you skeptical about taking a vaccine straight away, or would you wait until they improve it?
Well, it's a tough decision, Stephen, but I would certainly be seeking advice from my GP. And for those that might have, for example, a pre-existing medical condition, certainly seeking advice from your specialist. But I am aware that certainly there's some reservation around pregnant women taking that vaccine. But I wouldn't like to give advice there, only to say that in those cases, they should be consulting their GP and their specialists.
Because usually vaccines take 3 to 5 years to develop. We've gone ahead and done this in 1 year with an AstraZeneca and a Pfizer vaccine. I'm not sure.
Yes, yeah. And that's what's probably creating, that element of doubt. And, these things are normally tested over a number of years, and that's not the case with this. But, so it's, look, I am hesitant, I would say that, but I also think that, as a community, if we're going to get through this, I think that a vaccine, a safe vaccine, is certainly a part of that picture. And look, without a vaccine, I know that there are several states around Australia that are doing well, and Australia as a nation, but I think today we entered 28 days in New South Wales without a community transmission, which would suggest effectively you've killed off that virus within New South Wales. But we all know that with all these returning passengers from overseas, that Australian citizens who are returning from overseas, we still have to be vigilant. And and if there's any, my advice would be is the same as the government, that if there's any symptom of any cold flu symptoms, that for the protection of yourself and protection of your community, that you need to go and get tested. And the more tests that are actually done by residents of New South Wales, the government can be far more confident in either easing restrictions or reinstating restrictions. So it's really important. So we have, at this point, this is what we have to go by. And I would say that this is probably something we'll still have to go by after the vaccine, because I think they're testing at about 65-70% success. But by the same token, I know that if you want any vaccine to be successful, I think it's just over 70% that of the community needs to be vaccinated to ensure that it's actually that it's working within a community, not just for an individual.
No, because Peter, I hope life returns to normal. It's just not the same.
Yeah. I would say to you, Stephen, that life won't return to normal, but there will be a new normal. And what we're experiencing at the moment, I certainly hope that's not the new normal. But there will be a new normal. There's no question about it. Take, for example, all those people who have been working from home. I think there's definitely organisations that have expressed that they won't be returning to the way they were practicing their operations during pre-COVID. So I think there will be definitely more use of remote technology in the same way that you and I are talking on FaceTime at the moment. So as long as you can do your job effectively, via remote, I'm not saying that your entire role would be remote. And in fact, from personal experience in my IT career and managing a team of up to 50 at that point in time, there was no way that I could, even though I had the technology to do it, there was no way that I could actually continue my work, going out and visiting schools at the time, giving advice on committees and whatnot, if I wasn't actually physically present in my role. But that changes from industry to industry. So, I just think there will be a new normal, and that will probably be a new normal for almost everyone in their roles. So, we'll have to wait and see.
No, I just hope, because I'm a musician, that we can have concerts back on again to full capacity, go and meet and greet athletes like we used to. That's what I mean by normal. But I guess remote is the way to go. Like, everything's going online, I find. But I find, for me, I like to be in a classroom.
Yes, now look, and that's what I was touching on in that, yes, while everything is going online, I think that was a means to be sustaining, whether it be your business or a community group throughout the peak of COVID. I think, and I'd like to hope that a lot of those face-to-face things that we used to do within the community will return. And that may return to pre-COVID levels, but certainly other aspects of your life, there will be new normal for it. So,
I mean, 100 years ago we had the Spanish flu in Australia, and there was no vaccine for that, and the whole social distancing goes all the way back then, but that was a forgotten flu, Peter.
Yeah, look, and I'd say that given that we've gone through it in 2019 and 2020, and even into 21 now, I would say that there will be a lot of lessons learned from not only organisations but all three levels of government as well. And you'd hope that those lessons learned are well documented, so that in the case of future events, that these can be these are the kind of things we know what works, we know what doesn't, and those things that do work can be restated. But you take any given winter. There's always, as sad as it is, there's always a few thousand people across the nation that die from cold and flu. So, maybe there's consideration there for a social distancing and hand sanitizer during every cold and flu season. That doesn't mean it's a government-imposed health order. Just means that maybe organisations and individuals take that upon themselves during those winter periods when the cold and flu is prevalent.
Yeah, look, it does teach us to be a bit more cleaner, I think.
Yep.
Before the pandemic hit, I went on a cruise with the Royal Caribbean, and they were telling people to sanitize, and they were keeping it clean as well, because cruise ships are very easy to people get sick.
Yep.
But yeah, look, I just hope we can move on from this pandemic.
Well, I'm sure we will. And as I said, I think the vaccine is a good part of that. So that to the best of our ability, for those that do fall ill after the vaccination with COVID, that it won't be as potentially a greater impact on their health. They'll be able to actually with all hope, they'll be able to actually recover themselves because of had that vaccine. So ideally, that will reduce the number of deaths, and any death to any virus or any flu season or whatever it might be. They're the ones that really hurt the most. So and they really impact on families. So if we can reduce those numbers of deaths in anything that we're doing, then we're reducing that harm and grief on families. So I think that's important that we do it.
Because you look at countries, the United States and all Europe have been hit very hard, but they're not taking social distancing seriously like we did here. Which,
well, if I was to talk about the United States, for example, you spoke about Medicare earlier. They're not fortunate enough to have what we have in terms of the health system. So that's one concern that I'd have for those living in the United States of America. But also, they have their constitutional and First Amendment their rights. So I think that often causes some concerns for I wouldn't say many, but a number of people in the United States that they shouldn't have to be told by a government that they have to wear face masks and whatnot. Where I think the sensible middle ground is what we've been doing in Australia, and that is that health orders that allow for certain freedoms. But if you're in a space where you can't social distance, and let's say take transport as an example, well then you should still be wearing face masks. And I was out on the weekend. I was in Darling Harbour last night, and there were a lot of people, even though they didn't required to wear face masks, that still wearing them because of that risk to not only themselves but to people they're interacting with. So, and that's a good sign in Australia. And look, I can't speak a lot for Europe. I know, obviously, Great Britain and London have been, or England rather, have been, under great pressure from this as well. So, and I do know that England and London are actually looking at implementing some of the things that we have implemented. They've been talking with our governments. So, that's a sign of flattery. So, I think that we've done extremely well. There's no question about that.
Yeah, because UK, I know Melbourne's gone into another third lockdown for 5 days. It's like Melbourne's been hit very hard. Second full lockdown they had. Daniel Andrews was issuing a $1,000 fine if you didn't wear a mask. Because I know some people in Melbourne.
Yep.
But in New South Wales, we've been lucky, I think.
Well, we have been lucky, but I would say that's probably more through good management rather than luck. We've implemented a very strong and thorough hotel quarantining process, which has been, I would say, very successful. I mean, look at the number of citizens arriving back into Australia, and New South Wales and Sydney in particular is taking that lion's share of return residents, and we've had a hotel quarantine system that has coped and managed very well. And as I say, because of that, we have zero community transmissions for 28 days straight now. So, and that's what I mean. I don't think it's so much luck. I think it comes down to good management, and there's no reason why each state in Australia can't learn from other states, and I'm sure there's still more learnings to come. So,
yeah. Look, Peter, thanks for coming on the Stephen Shiels radio show today. Thanks for your time as well.
Yeah, absolute pleasure, Stephen. So I've really enjoyed the time myself. So if ever I can, revisit and come on, I'd be more than happy to.
It's always good to have you on, and look, thanks for your honesty as well.
Absolute pleasure. So, I'd like to think that if there's one thing that I am proud of is the fact that I am an honest person. So.
Hike the trail? Check. Order takeout? Check. Schedule heart checkup? Done. We've all adapted to a new way of living. Keep your healthcare on schedule with Johns Hopkins Medicine, where your health and safety are our highest priorities. We're ready to care for you through virtual and in-person visits across Maryland and the greater Washington region. Your health, our experts, safely caring for you. Schedule your care now. Learn more at hopkinsmedicine.org/safe.
The sweet aromas of the apple fritter, cinnamon roll, and blueberry muffin are hard to resist. So making it the rest of the way home without reaching in your McDonald's bag is no easy task. But nothing worth doing is easy.
Wake up and pair any one of these sweet, fluffy, frittery bakery treats with a McCafe iced coffee. Get any size and any flavor for just 99 cents until 11 a.m. Price and participation may vary.
Ba-da-ba-ba-ba.